Hi everyone, I'm Lymph.
G.
Ma.
Alright, so I'm going to be talking about the anatomy and function of our lymphatic system. So our circulatory system moves fluid throughout our body and it provides nutrients. And that fluid moves back up to be recirculated. However, some of the molecules are a little bit too big to go through our venous system and therefore has to be transported via the lymphatic system. So the lymphatic system in general is made up of the lymph vessels, the lymph nodes, and some organs, including the thymus, tonsils, and spleen. And it has two main functions. So the first one is to drain interstitial fluid and maintain the fluid balance between our blood and our tissue. And the second is to fight off infections and mediate immunity, which is more of the job of the lymph nodes. So the connective tissues in the lymph nodes, they are attachment sites for some of the cells of our immune system, including the B cells, T cells, some macrophages, and as well as dendritic cells. So for the prognosis, in general, lymphedema can't be cured. However, with the proper care and treatment, the affected limb can definitely be managed to a more normal size. And furthermore, we can help them control their symptoms so that they don't progress any further. However, if it is left untreated, there will be increase in swelling, tissue hardening, changes in tegumentary, and eventually there will be decreased function and mobility. As you can see in these pictures here, after treatment, these patients were able to get their swelling down as well as the inflammation and some of the side effects in the skin as well.
So before we get into the pathophysiology of lymphedema, I want to make sure you guys understand what transport capacity is. Transport capacity is the amount of fluid the lymphatic system can transport under normal physiological conditions. So the difference between, or one thing I want to make sure that we know the difference of is between lymphedema and edema. Lymphedema is when the transport capacity itself drops below the lymphatic load, whereas edema, normal edema, is when the load exceeds the transport capacity. So when we're talking about lymphedema, there's primary and secondary. There's primary, which it can be present at birth, or it can develop over time for no obvious reason, or it can be secondary, where it's a result of some kind of trauma like surgery or cancer.
I'll be talking to you about prevalence, and it is estimated that 180 to 200 million people worldwide suffer from lymphatic diseases. Over 100 million people worldwide suffer from filariasis, or otherwise known as elephantiasis. Up to 10 million Americans suffer from lymphedema and lymphatic diseases. More people suffer from lymphatic diseases in the United States than those who suffer from multiple sclerosis, muscular dystrophy, ALS, Parkinson's disease, and AIDS combined. All cancer survivors are susceptible to lymphedema, and there's an estimated 30% of breast cancer survivors will develop lymphedema in their lifetime. And not only adults are susceptible to it, but children can also be affected with debilitating lymphatic diseases. Okay, some signs and symptoms for lymphatic diseases include, in the first stages, patients will complain of subjective complaints such as heaviness or tightness in a body area where they're affected. And then from there on, they will actually have visible signs, which include inflammation, edema, pitting tissue, cellulitis, fibrosis and sclerosis, changes in skin such as hyperkeratosis and papillomas, and elephantiasis. So for the stages of lymphedema, it starts off with the pre-stage or stage 0, and at that point the patient does not have any visible edema, and all their complaints are subjective. Like I said before, they will have tightness or heaviness of a limb. Stage 1 will have accumulation of protein-rich fluid, which will lead to edema, and you'll have pitting in the area, but this will actually be reduced with elevation. Compared to in stage 2, that edema will progress and they'll still have that pitting, but it will usually not be reduced with the elevation, and they will have connective tissue proliferation. In stage 3, which is the advanced stage, they will no longer have pitting, edema, tissue. It'll fibrose and be sclerotic. They will have those skin changes I said before, the hyperkeratinosis and papillomas, and they will have elephantiasis, or that elephant looking leg.
So intervention and management. So some of the diagnostic tests that you'll be doing when you're dealing with lymphedema is first starting with the interview and evaluation. You're going to look at your patient, ask them appropriate questions, checking out their past family history and their medical history. Some other tests that you could do are the Stemmer sign, where you are comparing the metatarsals, or the size of the toes, between the affected side and unaffected side. And something else that you could also do is looking at the entire lower extremity in whole. Obviously, you're going to be taking girth measurements at the knee and at the ankle and comparing it to the non-affected side. So some of the treatments that you can do for lymphedema is the pneumatic compression pump, as you can see here. It's basically an entire sleeve that fits around the affected extremity. Here is the lower extremity part, and what it does is it works distally to proximally, slowly pumping or adding compression through the affected limb distally to proximal. So in addition to the pneumatic compression pump, you can also do decongestive or complete decongestive therapy, which includes manual lymph drainage, compression bandaging, remedial exercises, and skin and nail care, in addition to instruction and self-care. Okay, and so the goals of lymphedema treatment are obviously you want to reduce the volume, you want to control infection or prevent it, you want to restore mobility and range of motion, improve cosmesis, you want to improve their psychosocial mobility and their quality of life. In addition, you also want to be able to address their nutrition, such as limiting sodium intake and maintaining adequate protein consumption. And lastly, you want to get them moving. So some remedial exercises that you can do are aquatic therapy, and something that you want to emphasize is always when you're thinking about exercises is work proximal to distal.
All right, so one of the interventions that we can do is called compression wrapping, which is what Chris is going to do for Eric right now. So what he does is he's going to wrap up all the way along the leg, making sure to cover both the toes and the heels in this case so that we don't miss anything, and also making sure that the pressure is the highest distally, and as we move up, it should be decreasing so that we can move the lymph fluid up. Some other things we can do is we can use some stockings, and it's the same kind of idea, has the most kind of pressure down below, and then as we go up it gets a little bit more lax. Okay, and then there's also different types of cross hatchings that can happen in the fabric. So there's also different type of cross hatchings that can be in the fabric, and if it's cross hatch versus just one directional, it's a little bit more rigid. Okay, and so now you guys are just going to watch them perform this intervention.
So Gerardo will be demonstrating manual lymph drainage, which consists of a light massage. It's a very superficial, maybe on just the finger pads itself. There's obviously no homogeneity between the two limbs, so Gerardo is trying to push the lymph away from this area and back from proximal. The stroke itself needs to be unilateral instead of pendulous like maybe in other massages. However, the stroke is also distal to proximal, but you need to start working from the closer to the trunk and down the lower extremity.